Hello to all. This is Dr. Sue from Purely Pediatrics. I wanted to talk today about an important topic that has been affecting many families with regard to the viral illnesses that have been going around. These viral illnesses, most importantly, are RSV, respiratory syncytial virus, which is a virus that it can affect all ages, but generally is most aggressive with the littlest of infants and children under the age of 1, although we can see children over the age of 1 that also need some hospital support. So I want to not downplay that at all, but tends to more aggressively affect littler ones because they do have littler airways, and mucus involvement can really give them some issues with breathing. We also are seeing influenza that's causing signs of respiratory distress. A little bit less likely than RSV, but you can see it as well. Unfortunately, viral illnesses can lead to pneumonias, both viral and bacterial, so that's why pediatricians and family medical doctors, urgent care and emergency room doctors like to know the history, like to know how long symptoms have been lasting, and whether fevers continue to be involved. So unfortunately, pneumonia can be something that does occur. It's rare, but it does occur. So I want to make sure I mention that as well. Some of the other viruses we're seeing are hand, foot, mouth, which causes usually little red bumps in the back of the throat, and can also cause bumps, rash bumps right on the hands, the feet, the groin area, throughout the body, especially if a child has not had that illness before. We are also seeing what's called enterovirus, which can affect the tummy as well as the respiratory system. We've got adenovirus, which can cause pink eye as well as respiratory symptoms. And we also have the common cold, rhinovirus, which unfortunately can become aggressive as well. So these viruses are all hitting communities at once, which is making it very difficult. And COVID is still around. And remember, COVID is the great mimicker. It can be any symptom, respiratory, it can be tummy, such as vomiting, diarrhea, fevers. So COVID is something you can always test easily for right at home using a rapid test that you can buy in the store. And that's something best administered on days 2 to 3 of illness. COVID is still great to test for because not only does it help us understand the symptoms, but it does help us understand when multiple family members may be sick and that you want to avoid some of the most high-risk family members and taking your child to school and daycare and things like that. So COVID testing is still very important because COVID is also one of those viruses that can cause respiratory distress. So when I say the words respiratory distress, it means that we're having trouble breathing, that your child is having trouble moving air into and out of their lungs efficiently. What our body does is, in order to get the oxygen from the lungs, it will work very, very hard to make sure that air is getting to where it needs to go. You've got little balloons called alveoli in your lungs, and that's where your capillaries transfer oxygen from your blood to, from your lung to your blood. And oxygen is something every part of our body needs to survive. So what happens is, not only will we start to breathe faster, we will start to work harder. And faster breathing generally occurs when you get to 30 breaths per minute and higher. Mild increased respiratory distress is not always an issue. It does tell us that there's inflammation that a body is dealing with. And remember, viruses always cause inflammation. That is the big issue with viruses. So our body is trying to rid itself of this virus, and in result, it is making mucus. And mucus makes it very hard for our airways to function appropriately. So inflammation is the key word when it comes to viruses. And what can happen is we will get inflamed at our upper airways. It can move down into our lower airways. And what you can see is not only the rapid breathing, but you can see increased use of muscles. You can see increased use of tummy muscles, what we call belly breathing. You can see sucking in under the ribs, which are called subcostal retractions. You can see sucking in at the ribs, which are called intercostal retractions. And in the worst case scenarios, you can see sucking in at the neck and head bobbing. And that means that your child or a child that we see with those symptoms is really working very, very hard to breathe. In terms of the effectiveness of these maneuvers that our body just automatically does, and what we want to do is try to fix that before the body actually tires out. We can't continue to breathe that fast for that long. So when we see signs of respiratory distress and they move up from your belly all the way up to your neck, where you see the sucking in under the chin, at the neck, and head bobbing, we need to get involved quickly. Mild respiratory distress is something we want families to understand that does not always lead to severe respiratory distress, but it's something that you need to be on the lookout for. So again, you'll see excessive muscle movement at the chest and the tummy. You may see head bobbing when things become very significant with breathing. And ultimately, what we do is we want to make sure we know what our oxygen level is. Many, many families do have what's called pulse oximeters at home. And unfortunately, they're not all, you can get them anywhere. So in terms of quality, it's always hard to know exactly what somebody's using and what kind of testing it's been through and where they got it. But what I will tell families is that they want to make sure that oxygen monitor is getting a nice, steady reading, so we know what that reading is. We want to make sure it's left on for a few minutes so we know how accurate that could be. And I don't really necessarily condone getting that, because oftentimes the oxygen levels may be just fine, and it's really placement and operator error when it comes to issues with oxygen levels. But if a family calls me and tells me that the oxygen level is low on their own machine, I have no other recourse than to tell them that they need to actually be seen by a clinic physician that can actually confirm that. So don't feel like you have to run out there and get their oxygen levels. To be honest, when you see excessive work of breathing, that's when you can tell that the oxygen level may not be where it should be. And although we try to increase our breathing and increase the muscle use of our breathing, it doesn't always mean that it's effective. So that means that signs of respiratory distress are something that we want to make sure we pay very close attention to. Once an infant starts breathing in the 50s and 60s, 50 and 60 breaths per minute, and the way you can tell this is putting your hand on the tummy of the child or the infant and just counting how many times that cycles through in a respiratory pattern where that tummy and that chest go up and down. And you count that and have a second hand on your watch or set a timer and see how fast they breathe in a whole minute. And do that twice. And that can give you a good idea of when you call your doctor, you can say, I did this, I checked the respiratory rate, this is how I checked it, and this is how fast they're breathing. The more that you know how to tell your doctor about respiratory function, the better off it will be for everybody involved. So once you get to 50s and 60s, oftentimes those babies or those children will stop drinking. And that is a good indication that there is really significant work of breathing going on, and that little one needs to be seen, whether it involves support from breathing treatments, oxygen. Understanding what is happening means that little one needs to go in and be seen. I want you to also know that if you look at YouTube, there are many, many videos on what respiratory distress looks like. And I actually posted one on the Purely Peds site not too long ago. It was an infant with respiratory distress. So I think it's a great idea if you just check out YouTube, take a look at what respiratory distress looks like. And on there, you're probably going to see a mix of mild, moderate, and severe respiratory distress. But just get an idea of what we are talking about when we mention respiratory distress. If your child is playful, running around, drinking well, coughing, the likelihood of any significant respiratory distress is pretty low. If your child is sick appearing and they are laying around and they are coughing, you lift up their shirt, always lift their shirt up to take a look at their chest and tummy, and take a look at how fast they're breathing and how excessive that muscle use is. Those kids that are laying around, that are just working on breathing, they're not drinking, they just don't look well, those are the kids I worry the most about. Make sure you manage fevers as well. I know I mentioned this before. Keep in mind, fevers make us breathe faster. So that always makes us look worse. So make sure you get those fevers down. Then you can fully assess how your child is breathing. If you call your doctor, your child is at 102.5 degrees Fahrenheit temperature, your doctor is going to tell you, get that fever down first, and then I want to know how that baby's breathing. Remember, Tylenol is helpful for that. If your child is under 6 months of age, Tylenol is really the only option for medicine to get that fever down at this time. For children that are 6 months and up, ibuprofen is ideal. You can alternate every 3 to 4 hours with Tylenol and Motrin if those fevers are getting over 102.5. That can be very helpful, and your doctor can help you with the dosing. Dosing is always weight-based with children, so don't be afraid to reach out to your pediatric office for dosing if you need that. So I love families with kids over 6 months of age. Just start with ibuprofen, and that can be given every 6 hours. If needed, we can add Tylenol right into the picture there to keep that fever down. I want to make sure that families do realize that fevers make us look awful. So get those fevers managed before you feel that there's anything else that needs to be looked at. I want you to make sure to get that fever down. Remember, the height of the fever is not as concerning as whether that fever responds to appropriately dosed medication. We are seeing fevers up to 104, 105 in generally kids with influenza. I want to make sure that you know that those temps can be seen, and that's not something to run and get your child assessed for. That's something to make sure you say to yourself, okay, we need to manage this fever. I use Tylenol, ibuprofen. I know that I can do that, and then I'll see how things look, and then you go from there. Again, if you need help with dosing, let your doctor know. But fevers are not something to be feared. Fevers mean that your little one's body is working hard to get rid of what's most likely a viral illness. Let me see here. I know I talked about a lot. I know I went into a lot more than just respiratory distress, but everything is connected, and I want you to know that there's so much that you can do to help your little one right at home, knowing that your pediatrician is always on the other end of that phone if needed. So with respiratory distress, remember, get those fevers down, lift up that shirt. If you want to send a video or a picture to your doctor, lift up that shirt. Make sure that you can see what's going on at the tummy and the ribs and the chest. That's very, very important. Make sure you go ahead and feel comfortable to check a respiratory rate. Go ahead and check that for a whole minute, the whole up and down pattern. That's one breath. Up and down is one breath, and just count that. That'll be a great thing for your medical office to know as well. There are many ways that we can treat respiratory distress. That's more than I want to go into in this video, but I do want you to know what respiratory distress looks like. When we talk about it, what we mean. Don't be afraid to Google respiratory distress and look at some videos. And the more that you know, the better off it will be for you and your child. You know more than you think you do. So don't be afraid to ask questions. You know that we're here for you, as the medical community knows how hard these illnesses are on families and children, and reach out when needed. All right, you guys, have a great day. Thank you.